Have you been diagnosed with high FSH and want to know how you can get pregnant? Okay, let me read you a post one of the members of my Hope Fertility program posted just a few days ago. All right, so what she said was, she says, I have a few fertility wins to share. My FSH has come down since January. It's now within normal range. My A1C is also within normal range. Awesome on both. So I'm no longer in the pre-diabetic stage. These are huge wins. What I'm gonna not only share with you in just a moment is where she was when she started this program, where her numbers were, her labs, and where they are now, and what she did to get there. Just a few weeks ago, I recorded this video sharing some tips to lower your FSH. Today, I want to share a real case study so you can see that this is really possible for all of you, and that I've seen this very often during the 20 years that I've been helping couples get pregnant. Today, I'm going to go over what I recommended for this member when I created her personalized fertility plan, so you can start doing some of these same things to help you lower your FSH as well. A high FSH diagnosis can be scary if you don't know what to do to lower it. And the best way to do this is with working with a fertility expert like me that can create a personalized plan for you and your particular situation. So feel free to apply to qualify to join my Hope program and have me as your fertility coach. If you're not ready for that yet, but you want to get started now after your high FSH diagnosis, the tips that I'm going to share with you right now are going to help you get started with that. Now let's get started. Okay, so where I would like to get started is to just tell you a little bit about this individual. We're going to call her T for right now because that's an easy way for me to refer to her. Okay, now T, when she started the program, was 44 and had been trying to get pregnant for 2 years. I'm just reading my notes just so you can see why I'm looking down. So anytime you are 44, you're considered advanced maternal age, okay? She had 1 failed IUI, 2 failed IVF cycles that didn't work out. She was taking a whole load of supplements, many of which I didn't care for, but she was taking a whole load of supplements. This is not that uncommon. Her cycles recently were 24 days long, which are too short. And this was over the last 3 to 4 months. Prior to that, they were actually 26 days. But she had a good bleed, although she did have some vaginal dryness and she needed lubricant with intercourse. So here are what we found, okay, and what we were working on. Her labs showed that her estradiol, her E2 was low, her FSH was high, her AMH was low, and her DHEA was low. She also had, as you can deduce by her statement and her win, was that she also had metabolic issues. She had blood sugar issues. She had inflammation, she had hyperthyroidism, a short luteal phase, that's what happens when it's like 24 days or shorter, vaginal dryness, and some gut issues. And to round this out, I just do also want to explain her labs. So when I say her labs were low, her estradiol was 20, too low for my liking. Her FSH was 14, LH was 7. We'd like to see that closer together and hopefully that FSH between 5 and 10. And her DHEA was really low, 62, and AMH was also pretty low at 0.35. Although that's not my biggest concern, I'm just letting you know about that just for the sake of understanding the situation. All right, so we gave her her first plan in March. At her next lab tests, okay, in October, her estradiol went from 20 to 58. Her FSH went from 14 to 7. Her AMH stayed the same, which is also a win. That's great. And her DHEA went from 62 to 110. All of these things moving in the right direction. And I think the last thing I didn't mention before was that actually her A1C, her hemoglobin A1C diabetes marker was 5.8 previously, and now it came down to 5.6. This is huge, huge progress. So what did we do to get her there? Well, first, I want to hear from you. Are you surprised by her progress? Comment below and let me know. Does this sound familiar? Do you have a similar presentation, have a similar situation? Comment below and let me know. I want to hear from you. Okay, well, the first thing we did is I cleaned up her diet. She did a detox. We got her some gut support help because her digestive system wasn't functioning properly and GI function wasn't healthy. So we got her some digestive support. And then when it came to diet, we did ask her to do what we call a paleo diet or Paleolithic diet because it helps to reduce inflammation, helps to regulate blood sugar, and just gets us back to the basics. So that was the diet that we asked her to overall follow, although I did make some other adjustments adjustments to her diet. I did ask her to do some meditation and some stress relieving techniques at home. And as part of her home therapy, I also asked her to do moxibustion and vaginal steam and low level light therapy as well. All of these things she incorporated into her regimen, her regular daily, weekly, or monthly regimen, depending on what we were talking about. And then we did do a supplement protocol for her. Supplement protocol for her was giving her some supplements to reduce her inflammation, to reduce and regulate her blood sugar. We gave her several things to improve egg quality and lower FSH. And because her DHEA was low, in this case, we gave her a very small dose of DHEA as well. And that's how we saw this big change. I do want to mention, by the way, that we also asked her to stop taking a lot of the things that she was taking before because they weren't working for her. They clearly weren't getting the results that she was looking for. So that was what we asked her to do. And then these are the results that we did. And now that we have those results, she's in a much better place to get pregnant. So does she stay on all these things? No, we made adjustments again because after we get progress, we need to maintain that progress, and so we have to adjust some things. So that is how we supported her to get her from her high FSH and her other numbers that were not where we want them to be to a much better, safer place for her to have better egg quality, and more importantly, she is now ready to get pregnant. If you feel like you've been doing a lot for your health and fertility with no results or very little results, and you want to make sure that you have the best team on your side like she did, then head on over to marksklar.com/discovery call. I'm going to drop that link in the description below as well to speak to a real human on my team so we can identify if having me as your fertility coach is the right next step for you on your fertility journey. If you want to learn more about FSH, I'm also going to drop in this video right here for you to check out. And until the next video, stay fertile.